Hello, everybody, and welcome to the next Pathways to Purpose with NSOF. We are thrilled to have you, and today we've got an excellent panel. We have Lauren Behr, who is a VA rater for the Benefits Delivery Discharge, and Todd Neal, who is active duty EOD, who is also an expert in this area as well, having gone through the process himself. So with that, I'm so excited for this panel, so I just want to jump right in. So Lauren, I would love it if you could introduce yourself to the group here today.
Yes, thank you for having me. I'm excited to be here today. I am a VA rater. My current job, and you may be asking, what does that mean? And I am that individual that determines what is or isn't service connected, the percentage that disability may be at, and you get your narrative and your disability compensation. I've been with the organization for pretty much about 5 years now. I've jumped around to a couple regional offices. My husband was prior active duty with the EOD community and has officially been out about roughly a year now. So that's how I know a lot of you individuals or have gotten with you guys, is because of my husband. But what I'm going to talk about today is pretty much just the BDD claim process, and that's for individuals who are currently active duty and who will be filing a claim between 180 and 90 days before discharge. If there happens to be individuals who have already transitioned to civilian life and filed a claim and have questions on that, feel free to ask questions during the Q&A session. But the laws and regulations that I will be talking about strictly today will be only about BDD claims. I can answer a few questions about individuals who are doing IDES claims, but that's not my expertise. I do currently work on an IDES claim rating team, but if you have specific questions on the rating policy for IDES, I feel free to message your questions and we can, I can ask the team and get an answer for you, but I am not an expert on that. So I would probably have to get back to you if you have questions on that IDES claims. But otherwise, I know Todd is here also, so we'll continue. He can do his introduction.
Hey guys, most of you know me. I'm the guy who set up the Facebook group called Naval Special Operations Transition, and trying to put together resources so we can kind of, knowledge is power and get through this together. We've gone our entire careers helping each other out. When we go through transition, there's no reason to stop that good trend. So I'll turn back over to you, Lauren.
All right, I'm going to go ahead and share my screen. I did a PowerPoint that kind of walks us through the BDD claim. If there's anybody who has questions as we go in regards to that specific topic that I'll be talking about, please feel free to either ask the question in the text box and someone will ask it verbally, or you can, if you're able to unmute, feel free to ask. If it's not a question relating to the topic at hand, then we'll wait for the Q&A session to not confuse anybody. But I'll go ahead and share my screen here. All right. Hopefully I can't see anybody anymore, so I'm hoping y'all can see this. But again, like I said earlier, the claim process that I will be talking about is the BDD claim. And what I'm going to do is walk you through on what should you file, how to file it, where should you go, the whole process from start to finish. And hopefully by the end of this presentation, you guys will understand a little bit more of what to do, and it's not confusing as you transition to the civilian life, because this is a very important claim. Out of all claims to file, I highly encourage you to not miss out on the BDD claim process. This will be your only time that it will be the easiest time to get service connected. And I highly, highly encourage everyone to don't be late, don't miss out on it. But just as we start, I'm going to talk about first, kind of explain to you the requirements of how we service connect each disability and how it relates to the BDD claim process. So the first element to get service connected is to have a current diagnosed disability. And then the second element is an in-service injury or event. And the third element is the nexus. Now, why these elements are so important for the BDD is you have already met all three elements if you have a diagnosis. So there's no question. When you file your claim, we're going to send you to a whole bunch of examinations. Those providers, medical examiners, are going to evaluate you, and they're going to pretty much tell us if you have or have not a diagnosis. If you have a diagnosis on that exam, we're going to automatically grant you. It's the easiest time to get service connected. Once you transition and you are now civilian filing a claim, we can no longer automatically link it. So there has to be medical opinions, and the longer you stay out, it's the harder to meet element number 3. So that's why filing a BDD claim is important, to do it while you're still active duty and within the specified time frame, because already you're given all elements as long as you have a diagnosis. Now, keep in mind that it's case by case basis for each individual. The only time that we will request a medical opinion on a disability is if you had something on your entrance exam. So if you entered the military and you had a left knee surgery and you're claiming left knee now, we will have to ask an examiner if your current diagnosis was aggravated by the military service because you had a pre-service condition. So that would be the only time, the little bump in the road on any disabilities. But pretty much whatever you claim, you're going to get an exam. Now, going back to what is a BDD claim, this is a claim that you would file while you're active duty, and you're going to file it between 180 to 90 days prior to your separation. So you want to make sure you know what your separation date is, and then you want to start thinking to yourself what you're going to claim. Think about your whole entire career, the injuries that you've had incurred over the span of your military career, and start making a list. Now, I do know some of the VSOs, the veteran service reps, have been a little bit backlogged. So it's important that when you hit day 200 before discharge, I would start scheduling appointments, just so you can get your claim submitted right at the 180-day mark. Now, these are the requirements that you need to know before you submit your claim. If you don't have these on your claim process, you're going to be kicked out of the BDD process, the claim. So you need to know your separation date. You have to provide a copy of your service treatment records. Most of the time, you can, I think lately they've been giving links and they send the link off to the VSO and it can automatically be uploaded. But if you happen to be filing this claim on your own, as long as you submit 10 records, it does justify that requirement. Just make sure you submit some type of service treatment records. You also need to make sure that you're available for exams 45 days from the date of the claim. We currently at the VA, I would say, are scheduling exams roughly 7 to 14 days after you file your claim. You should be getting a call for scheduling purposes. So it does happen pretty quick. Some issues that will exclude you from the BDD program are members who are terminally ill, seriously ill or injured, have lost a body part, medical discharges, those who go through PEBs or MEBs and all those different physicals. Those are usually done during the IDES process, and that's the IDES claim. If you got in trouble and you're going to be dishonorably discharged, that will also kick you out of a BDD. process, because if you do get a dishonorable discharge, then the VA has to make a determination on if you are going to receive compensation or just hospital care for service-connected disabilities. So that kicks you out. Now, to start your claim process, when you have reached day 200, right before you submit your claim, there's two main VA claim forms that you need to submit with your claim. The first one is the 526EZ, and this is the application that will have all your disabilities on it. It's also going to inform us of your expected discharge date. It's going to provide the address, your phone number, your banking information of how to pay. It has all of it on the 526EZ. And the VA form 2140 or 4138 is used to add additional benefits, because the 526EZ only has so many slots to put the disabilities on. Is there any questions? Have I confused anybody before I go on? Okay. So this is an example of 526EZ along with a VA form 4138. And don't worry about trying to write down the list of disabilities. I do have a slide that does have a list of disabilities for potential claimed issues, but I just wanted to use this as an example. But as you can see here on the 526EZ, it has 15 slots for what you're claiming, and that's it. You can't really add a whole bunch of pages. So if you notice on box 15, you would sit there and put see attached 4138 for additional disabilities. And over here, you would just add additional disabilities and just start listing what you want to claim. Now, I would recommend anyone, even if you're going to use a veteran service rep, which is DAV, American Legion, or any of those to help you submit this claim, I recommend you filling this part out before going. Although all those veteran service organizations are wonderful people, it is your life and it's your disability compensation, and it's important that you are in control of it and do not rely on someone else to tell you what to claim. I tell you this because I have seen many, many claims where an individual goes to a VSO and expects the VSO to fill out what disabilities to claim. The VSO doesn't know you. The VSO doesn't know your background. They don't know your career. What they're going to do is go to your service treatment records. And if you've ever looked at your service treatment records, you're going to see a list of chronic problems. And they're going to copy that list. I would advise you not to do that. You will be a very sad individual if you copy that list and you submit that as your claim. Why? Because there's a lot of lab results on that, like hyperlipidemia, which is not service connected. It's a lab finding, and we will not service connect that. Disability will deny it. So that's why, and a lot of you guys are gone. You are constantly training, deploying, doing military evolution, that you don't have time to submit your claim. And you haven't been, or I'm sorry, not to submit your claim, but you haven't had time to get treated for specific disabilities. So your chronic problem list will not show everything that you want to claim. So the other thing is a VSO may tell you, and I have seen this in a couple other EOD techs who have filed claims, they'll send you an email saying, do not file anything that is not in your service treatment records. I am here to tell you as a VA rater, that is false. You claim everything. I don't care if you have never been seen for it. If you see on the list, painful ankle conditions, and you think back, I have never been treated for that. If you hold a parachute badge, if you hold a combat, a valor, or anything, I highly recommend you just claim it. Why? Is because the moment you submit your claim, while you're on active duty, I view it as a treatment record. Your claim for all these disabilities now turns into a treatment record. It is now meeting element 2, which is an event in service. So just by you submitting this claim on active duty, it is automatically satisfied element 2. So I do not care if you have never been seen for that condition, you claim it, because this is a treatment record. You are a competent individual to tell me something's wrong. That's why we send you to an examiner to determine if there is a diagnosis. So make sure you claim everything you can. Now, there's a couple other parts on the 526 that are very important. And if you don't fill those out, you can get kicked out of the program, and you can pretty much, they'll delete your claim. But if you notice the most recent active service dates, make sure you have your exit date. Now, some people, when they file a claim or when they track it on va.gov or eBenefits, I know they're revamping the system. They'll show at the beginning when you track your claim, oh, you submitted it on July 1st, 2021. Well, all of a sudden, a week later, it jumps to December 2nd, 2021. The reason why is because if your anticipated separation date is December 1st, then we have to match the day following your discharge in order to be for payment purposes. Although we received it on active duty, the date of claim is what guides your payment date. So don't worry about it. Don't stress if all of a sudden it jumped to the future. We do that for pay purposes. You also need to make sure you sign your application. If you submit it through a VSO, a lot of times it's electronic signature. If you submit it online, you don't need to sign because it's all done through the system by yourself, so you don't need to worry about signing it. Moving on. And this is what not to do. So if you notice on this claim, it shows disabilities for a claim for Gen Med claim, a claim for Gulf War exposure, a claim for particulate matter, which is a hot topic lately, a claim for arthritis, and a claim for muscle strain. These are bad ways to claim. The reason why is a VA rater is not allowed to assume any diagnosis is claimed by a veteran. So when you claim muscle strain, I have no idea which muscle has been strained. You have lots of muscles in your body. So you have to be specific. You need to let us know exactly what location is hurting. If it's your thigh, your forearm, your right, left, arthritis, your right ankle, left knee, make sure you're specific. If you claim Gulf War exposure or particulate matter, exposure in of itself is not a disability. Those are ways that we use to meet element number 3, which would be the nexus or link. Particulate matter, Gulf War exposure, a lot of you have gone to those regions and you've seen emails or Facebook posts about, oh, if you have asthma, rhinitis, sinusitis, claim them if you were in this area. For those that are filing BDD claims, you really don't need to worry about it because like I said before, everything you file is a treatment record. You're already active duty. So if you get a diagnosis for asthma on your exam, that exam was conducted while on active duty, we're just going to grant you. We're not going to relate it to particulate matter. We're going to grant it on a direct basis, which is the best way. Gen Med claim, the very first one, I've seen this lately, so I'm not sure if there's someone telling people to claim it that way. Again, I don't know what a Gen Med claim is. I have no clue even how to order an exam if you claim that. We will try, if you do claim stuff like this, it could hold up your claim because we're going to try to get a hold of you, try to get clarification. A lot of times we just send letters instead of calling. So if you don't respond to those letters and I get it as a rater, I'm going to put a little paragraph in your introduction saying, you know, Gulf War exposure in of it itself is not an exposure. You did not claim a specific disability. we wrote you a letter on this date. To date, you haven't responded. Therefore, I'm not making a decision. And I just leave it at that. I don't deny it. I don't grant it because I don't know what it is. I'm not allowed to assume. So make sure you're, in a way, you are specific. Now we get to the fun part of what a lot of people get confused on is, what do I claim on this BDD claim? And if you have a 30+ list of disabilities, you're doing it right. Now here is a start for all you guys to claim. Like I said before, if you hold a combat badge, if you hold a parachuting badge, a Valor, any type of deployment, you should be claiming every joint possible. I don't care if you were ever seen for it, you should be claiming every joint possible. Because parachuters, how many times have you guys had hard landings? Every hard landing, every landing is very hard on your joints. It affects your joints in your whole body. Combat, you know, wearing the helmets along with the nods, that's 5 pounds on your neck with it right on front. You should be claiming that because that is very hard on your neck. It's hard on your back carrying all that gear going up and down the mountains. All these joints should be claimed. Hint, hint, claim every joint. Dry eye syndrome. That is a very common one in the EOD community because of the exposure to chemicals and everything. You should be claiming that. Now, there are some individuals who will be denied because they had LASIK or PRK in service. If it's determined that your dry eyes is a result of your LASIK procedure or PRK, we cannot service connect you because LASIK or PRK is considered a special surgery. It's not required, and it's a known complication. It's an elective surgery. So make sure, you know, if you do claim it and you have the LASIK, if you get denied, that's probably why. TMJ, you know, look some of these up. You may not know exactly what they are, but if you look them up and you look at the symptoms, you may realize you have it. You know, TMJ is pain in the jaw. It happens a lot to individuals who've deployed a lot, the stress of being away from home, the evolutions of, you know, training. You know, you just tighten your jaw and put all that stress in your jaw, and some of you get arthritis and it's painful. And every time one of these joints has a diagnosis and it's painful during an active range of motion, you're going to get the minimum compensable evaluation, which is 10%. And 10% adds up very quickly. So all these joints, the neck, the shoulders, carpal tunnel, elbow, painful wrist, the hand. Fun fact about the hand is we will give you 10% for your thumb if it's painful, 10% for your index if it's painful, and 10% for your middle if it's painful. So that's a 30% evaluation for your fingers alone. The other two, your ring and your pinky, are not important. You don't get anything. But those who go to combat, who have deployed a lot, their right hand, or what are your dominant hand, your shooting hand, you get the trigger finger. So you may not realize it, but if you go and do some type of training evolution and realize how sore your fingers are, that should be on your claim. You should be claiming bilateral hand condition. If you claim hand condition, it does cover all fingers. Skin conditions. Again, I have it in the notes here, the location of the skin condition, because if you have rashes on your arm and then you have athlete's foot on your feet, that is two different skin conditions and can be connected separately. Acne is also different. Going through these, painful foot, that's a big one. If you have sleep apnea, if you were given a CPAP or BiPAP or an oral device in service, it's an automatic 50%. Headaches is also a big common one. If you don't have hypertension and you don't even think you're close, don't claim it. I mean, you don't want to claim a whole bunch of made up disabilities and go to the examiner and them saying, well, you have hypertension. Well, no, I just claimed it. You know, you'll lose your credibility. So if you know you don't have hypertension, then don't claim it. TBI is a big one in the EOD community, along with those who have deployed PTSD. I always claim it as PTSD to include any mental health condition. That way, if your PTSD exam comes back as no diagnosis of PTSD, but it shows adjustment disorder or depression, anxiety, you kind of claimed it to cover it all. IBS, GERD, here's the sinusitis, rhinitis, asthma. That's that particulate matter. So as long as you claim it, we're going to look at it. The chronic cough, fun fact, my husband did do a few deployments to Iraq and Afghanistan, and he did develop a chronic cough at night. We speculated at the time, because of going out on missions, he would come back and his face would be all black from shooting the gun or whatever. And so I'm sure breathing that in wasn't amazing. So he developed this chronic cough. We claimed that. He went to a PFT, a pulmonary function test, to test that. And it came to find out that he has some bad lungs from that. So I would, if you have some type of respiratory or chronic cough, I would claim it. Just claim it. Erectile dysfunction. Now, I know a lot of people don't want to really talk about that. I know TMI, but I pretty much see it all when it comes to these claims. But ED, we grant on a percentage. If you if you're deformed or if you're crooked, then you'll get a 20%. If you just have erectile dysfunction, you will get a 0%, but then you get a special monthly compensation. The special monthly compensation, the last time I looked, was $111 and some change. So that would just be added to your overall benefit versus an actual percentage. Ingrown toenails, varicose veins, any fractures, again, you need to name the location, be specific about it. PFB is from y'all shaving a whole bunch. You may get like a rash type acne on your face. If there's scarring from that on your face, that's a big percentage right away if there's disfigurement from it. I have noticed an increase in EOD techs getting service connected for urinary frequency, for peeing a lot, like 1 to every 2 hours, and waking up for voiding dysfunction. Surprisingly, I've seen a lot increase for that, ranging from 10 to 40%. Vertigo and dizziness, usually that is a symptom of traumatic brain injury, but we can use it to piece out for a higher evaluation. Chronic fatigue syndrome, restless leg syndrome, you can find that if any of you all had a sleep test, a sleep study for sleep apnea. That's usually where the restless leg syndrome is diagnosed. I would advise you to look at your sleep study test and see if you have been diagnosed with restless leg syndrome, because that can get to a compensable level. So moving on from this, again, I don't care if you ever have been seen for it or not, just claim it. If your claim is less than 10 disabilities or conditions, you're wrong. You should be claiming everything. This is the one time, this will be the easiest time to ever get everything service connected. The moment you discharge, the laws change and it gets harder and harder and harder. So it's a lot easier to do this now and do it the correct way than doing it later on. So if you are thinking about waiting and file your claim until after you get out, do not do that. Do not. I have had many guys who have come to me and asked for help and they waited, and it's done because of your guys' job. We can get you there, but it's just a lot harder. And this is the time to not suck it up, to not be tough. I hope you are the biggest baby. Ask your wife, your spouse, your significant other. You know, if you've claimed anything, you may have other things that have come up. Disease past, like diabetes mellitus would be another one. If you've been diagnosed with that, then claim it. Just make sure you're specific if you're claiming a joint or skin condition, so we know exactly where to order the exam and to evaluate it. And this list is also on Todd's Facebook site. So if you didn't get a picture of it or you want to look at it later, you could always go to Todd's Facebook site to help you with that. Now, once you've figured out what you are going to claim, you have to figure out how you're going to submit your claim. So any VSO, American Legion, DAV, VFW, there's hundreds out there. You can go to the va.gov website /VSO, and you could type in your zip code and it will pull up all VSOs in your area, and you can use them. And I highly recommend you use a VSO to ensure you submit all the claim forms properly. But again, do not rely on a VSO to tell you what to claim. And even if they send you an email that says, do not claim anything that's not in your service treatment records, you claim it. That's wrong. That I can tell you it's wrong, and that's against the law on the 38 federal regulations and how we view it. So claim everything, but use them to upload all the forms to ensure you get it right. You could also submit your claim at any VBA regional office. Public contact is where you would go for that. You would fill out that 526EZ 4138, and they will help you submit it along with your treatment records. We do have individuals who do work on some military bases known as military support specialists who can also assist you on submitting your claim, or you can do the online submission at va.gov. Again, if it was me, I would tell you to go to a VSO to ensure that you are submitting all the forms correctly, but do your claim yourself. Do not let a VSO tell you what to claim. And this is the point where Todd is going to take over soon. He did just finish all his exams. You know, after your claim submitted, he'll tell you everything about what he experienced. But before I go hand it over to Todd, I'm going to just talk about the in part of the rating, because this is the other thing that I hear a lot from. And people ask me, you know, am I permanent in total? And we don't tell you at the VA in your rating if you're permanent in total. How you tell if you're permanent in total is if you've been entitled to Dependents Educational Assistant Program, or DEA. It will state that in your narrative, and it will state a date and everything. If that means you are 100%, we will not recall you, and you can continue to work after the military, even if you're 100%. So if you heard a rumor that you can't work if you're 100%, that's true and false. If you got IU after you discharge, which is individual unemployability, and that makes you, if you are 80%, we jump you to 100, but you cannot work if you got 100 off of IU. If you got a rating that says you're 100%, but you do not see DEA, we're going to be recalling you. Now, for BDD claims, it's extremely rare for any of us to recall you. Pretty much ever since 2018, guidance has been put out that it's a waste of money for these contractors, for you to be recalled and reevaluated on your conditions. I see a lot of recalls being done on the IDES process. So if you're 100% and you don't see dependents, the DEA in your rating, you need to look for one little sentence under each one. You could be recalled for multiple disabilities. And that sentence should say, since the disability is likely to improve, we will readdress this disability in the future. And you're going to be recalled. And that recall can range from anywhere between 1 to 3 years. Now, if you play the game where it's like you don't go to the exam, don't do that. Because if you fail to go to the exam on a recalled future exam, we have the right to drop you to a 0 for that disability. So I recommend you just going to the appointment, okay? But otherwise, I will hand it over to Todd so he can explain to you what he went through when it came to the exams and how everything went for him.
So I think before we move on, I see two questions and I'm going to read them out to you. One of the questions was, the VSO will assist us with populating the forms to ensure that they are correct.
Yes, yes. A lot of VSOs use an online program. They almost submit it online. So they won't necessarily need your 526. They may use your 4138 and upload it because it's less they would have to type. But they will assist you in uploading it, ensuring you have all the forms. That's their job. So that's why I always encourage you guys to go through them as a safe haven to make sure that you crossed your T's and dot your I's with all your paperwork and everything.
All right. Second question was, do scars also include scars from surgeries?
Yes, it does. If you had a surgery on your knee, your back, your ankle, any type of surgery that left a residual scar, absolutely claim it. If you even had a laceration, claim it. Now, word to the wise for rating, when it comes to scars, you can get a 10% evaluation if it's tender to palpation. Not painful in moving, there's a difference. Tender to palpation. It has to be painful to touch. If you tell the examiner, oh, it hurts when I move my arm or it hurts when I bend my knee, you're gonna get a 0%. But if it hurts to touch, that's a 10% evaluation. If you have 2 painful scars, you're gonna get a 20%. It kind of goes up from there.
All right, that was the last question I saw. Okay, hey guys, with anything, it's kind of good to kind of know what you're getting into. There's no operation that we would ever do. We wouldn't do intel or do our homework. Nope. To date, I've never seen anybody just show up in their master board and just try to wing it and pass. And if that guy's out there, good on him, but he's definitely less than 1%. So really, I kind of put together a lessons learned of things that I did to go through after I submitted my claim, the whole medical part, to kind of, because there's nothing out there telling you or preparing you for what to do or anything. So like Lauren said, this is the Excel spreadsheet that actually she helped generate. And all I did was I put X's next to all the things I had. I reviewed my medical. First, I started with all the things I knew I was already being seen for, either for physical therapy or the doc. And then I kind of went through my medical record and looked for things. And I actually was surprised how many times I'd had bronchitis. So I put that down. I took and printed this out. And when I had my appointment with the VSO, I handed her this. And she literally used this to fill out the form. And if anything, it'll be a good guide to brainstorm. I've had cups of coffee with a couple of guys, and they're just like, I have no idea what to even claim, right? Well, this is what you claim. It's a brainstorming tool that'll let you go through and be like, yep, I've got that. Yep, I got that. Print that out and give it to the VSO, or use this to fill out the easy form that Lauren talked about yourself and submit it. Now, as far as the VSO goes, really there were some forms that are pretty general that they want. If you've got prior service, they're going to want to see those previous DD-214s because they have to add that to the system. And then if you have dependents, you're going to need to fill out the add or remove dependents, and they're going to need their socials, and that's pretty much the big parts of socials. Then the second one is request for approval of schools attendance. See, I have my daughter pretty much turns 18 1 month after I retire, and she will still be in high school. So I had to fill this out and kind of have it ready. So as soon as I retire, I have to submit this thing because she'll be dropped off, and I need to kind of keep her on there until she's out of high school and or starts college. Admin side. I don't know what everybody else's experience is with their admins at the mobile units and stuff, but nobody handed me a check sheet or anything like that that said, hey, here are all the forms that we need. It's kind of like, I mean, even at the group, it's like an afterthought, like, oh yeah, you need to fill out this form, right? Out of all these forms, I would tell you probably the most important one is the fourth one, that DD 2656, the data for payment of retired personnel. One, that you're going to get paid off of that, and two, that's where you're going to elect your survivor benefit plan if you decide to elect that. In my research, I found that DFAS wants this 6 weeks prior to your end of obligated service. And again, the only people who would be filling that out are those who are retiring. Those who are just transitioning out of the military, you will fill out every one of these forms except that one.
We have one question that came in through the chat. If you please explain the relationship between DDQs, 21536EZ, and other conditions that are expressly identified in a DBQ.
Okay, I'm going to get to DBQs here in a second, and I'll be able to hit that.
Thank you.
So for me, I used the VSO, right? What I learned from the VSO is that they'll call and they will not leave a message, and you have no idea who they are. So I was worried that QTC, which is the medical group that the VA in San Diego contracts to do all your medical appointments and physicals and things like that, I was a little worried. So I kind of collected these numbers as they called me and put them into my cell phone. So that way I could never miss these guys when they would call me. Also too, they get all your contact info also from the va.gov website and anything you provide them. So when they call, I mean, every phone in my house would go off. I mean, my home phone would ring at the same time my cell phone would ring, and they would literally send me a text all at the same time. So it was like little excuse for me to say or to miss them trying to contact me. One thing that was note for me is it was literally 7 days I got a call from QTC from the time my claim was filed by the VSO. I got calls to schedule appointments. And let's see, for that's pretty much it. If anybody is on the Facebook group, I posted the actual file for this that you could download and like just upload it into your phone that would get this. What I would like to see is someone who say is on the East Coast do something very similar to this, so we can kind of get a feel for what's the baseline thing of how everything runs on the East Coast and have these same numbers so guys can go up. I'm on the East Coast. I'm going to add all these phone numbers to my cell phone so that way I know exactly when they call me or email me. So one thing that they asked me to do was register for their website on QTC and create a portal page. And the portal page, a good part about it is that you literally can see every appointment that you have, and as well as you can view and download the documents that come in the physical package that I'll show you in the next slide, that you'll receive via FedEx. So, within like 2 days, you'll receive a FedEx package. And in that FedEx package, you're going to have all these little envelopes. And each one of these envelopes are for different claims that you made. One is for your, so one of these was for my eyes. The other one's for my compensatory, or there was one physical you do that's like almost an all-day physical. And it's like every joint, every range of motion, all that. So they divide these up and they give you the times of your appointments inside these envelopes. This is roughly what you'll see. You'll have your appointment, what it is, and some data about pay, don't pay for insurance. The second page is about your doctor, what his qualifications are. Mostly every doctor I had was a doctorate, right? And the doctors that I had, none of them had ever been in the military. But pretty much every one of them, this is all they do is do VA claims. And they were kind of familiar. I did not run across anybody that didn't know what EOD was, which was surprising to me. But I'll tell you, out of all these sheets, the medical evaluation protocol sheet, that's the one you need to focus on. So pre-mission planning, right? You're going to review your QTC envelope contents, which we just went over. You're going to review the DBQ, which is the Disabilities Benefit Questionnaire. Well, where do I get those from? Well, I just Googled them for each condition that I had. For the one that I had vertigo. And so I went out and looked for the one that's vertigo. Or I had an ear condition for tinnitus. So I went out and got the ear condition, right? Every one of them that I found, I uploaded to the section. I made a section on the NSOF Facebook group for DBQs. So you can go there as well. And I encourage people, as you find ones that aren't there, to put them there so guys have a one-stop shop resource. Here on the right side, the left side, is kind of what the front page of a DBQ is. And this is my understanding is what the doctor fills out when you're sitting there. Like literally you have the answers to the test. What I used it for was, it was a great way to brainstorm and go, oh yeah, I need to talk about that. Or, oh yeah, I do have pain there. Or, it just was a good trigger to help me figure out or fill out the medical evaluation protocol sheet that's in the package, which is on the right side. Now, once you fill that out, you're gonna take that and you're gonna give that copy to the doctor when you show up to your appointment. My recommendation is that you make 2 copies. So when you show up to these appointments, right? Well, be honest. Be honest about what's wrong with you, but also be honest about, like, this is not the time to like tough it out, or, this is not the time. So be honest to yourself and be honest to the doctor about your condition. Toughen it out. Those days are over. And if you try to tough it out, you're going to regret it in about 2 or 3 years, because everybody that I've talked to has, after leaving service, for some reason their body just starts breaking down. All those things that just kind of ached hurt. And then it goes from hurt to they can't work because they're in so much pain. The realization is, guys, we're young now and we're just doing nothing but getting older. And as you get older, your youth can't mask the pain anymore. You, like me, I scrape something, skin myself up. Instead of healing in like 24 hours or 48 hours, it takes me weeks. So think about those things when you're filling these things out. So like I said, use the DBQ. It's literally what the doctor uses to fill out. He's going to ask you questions. Some of my doctors would review the medical evaluation protocol sheet that I gave them, but most would just go, oh, thanks, and set it down. But they do, I honestly believe that they review this after you leave the office to fill in any things that they didn't ask you or forgot to ask you or whatever. Like I said earlier, print a copy out for the doctor, print out a copy for you. These are your notes. Just like any board that you may have done, you kind of bring notes in, you bring a notepad because when somebody asks you a question, you know the answer, but as soon as you get asked the question, your mind goes blank. So what's wrong with you today? Nothing. I can't think of anything. No, there's plenty wrong with you. You just start reading through the medical evaluation protocol as your notes and just start talking about what is wrong with you. Now, I will say this, when you fill this thing out, pepper in what you do, right? And I say that because, I don't know about you guys, I usually tell people, it's like, hey, what do you do? I'm in the Navy. And they're like, oh, how are them ships? And I'm like, well, I don't know. I don't do that kind of work. These things are the same way. They're stereotypes, right? There's, if you don't put something in here that kind of differentiates you from being a CS, a cook, or, an LS, which are all good jobs, when you start talking about being in combat, like, well, okay, you're an LS in combat. Yeah, you were probably just on the FOB, right? Rather than being an EOD guy in combat outside the wire, or, doing parachuting operations, as most of you guys know, I broke my leg, you put stuff like that. You don't just say, oh, wow, jumping. Well, jumping may not mean anything to them. Oh, what'd you jump off a bed? No, while I was doing military free fall operations, I broke my left leg and and had to go have surgery. So you paint a picture, right? And including, recommendation was made. It's like, if you've ever been issued a brace, which I did for my broken leg, anything you were issued, you talk about it in here. And you guys know, as being EOD guys, pictures worth 1,000 words. I literally would take a picture of this thing and like scan it and like show it to them and attach it to the document. So that way, when they flip over the back of it, it's a picture of the brace. Oh, he had a brace. Because I do know there was one appointment, I totally forgot to even mention it. But the doc sit there and like flipped it over and went, oh, you had a brace. I was like, oh, yes, I had a brace. Totally forgot about that, even though I put it in my notes. So you're just trying to put things in there to trigger your memory, to paint a picture for him. Put a picture if you have to. I type mine out because I have terrible handwriting. And, it actually became a topic, that I would walk in, they're like, oh, you typed this out. And I would make a joke. I'd be like, yep, not everybody's a doctor, man. People have to actually read my handwriting. Like, and every one of them laughed. So that, now, once I was doing that, finished all my appointments, I'll be honest with you guys, I have never once logged into e-benefits through my whole transition. I have only logged into va.gov. And on va.gov, I was able to put my routing information, my bank information, educational VA, because it separates it, account information. So they have all that to be able to send you your VA checks, I guess, if you rate that. But you can see here on mine, remember, I said my retirement date is 30 November, so you will see that the very first thing, after like claim received, initial review, gathering evidence, then it says 1 December 2021. Thank you, VA received your claim. That's the day after I'm out of the military. So, you know, I do all this, but they're not going to look at it until that date. And probably well after that date, because there's a backlog. There's always a backlog. But when you see a date that's way out, that's not because they made an administrative error, because that's what I thought happened. And I called Lauren. I was like, hey, they made an error. It's like, no, that's the day after you retire. Oh, okay, yeah, that makes sense. But you can see on here, they requested more information from me. And I simply went and uploaded that information per their requests. And it was pretty simple. And I would assume that this will not be checked off as complete until sometime after, 1 December. Now, as far as resources, I've mentioned a couple of times for anybody who doesn't know, start a Facebook group so we could collaborate and share experiences and lessons learned and what works and what doesn't work, so you don't have to do this alone. I am amazed at how many EOD techs and divers that I've talked to that have gone their entire careers. Say you've never done something before. You will happily walk over to the platoon next door to someone who has done say, expedition CM before or something. Well, hey man, I've never done this. What should I do and what should I not do? And you'll take their advice. But man, when it comes to retirement stuff, you guys like purposely close yourselves off for some odd reason. Don't do that. Your brothers are still there. There's somebody that's already gone through this. If you have a question, somebody has an answer. And you just have to answer the question. And another thing I'll even point out that, and I'll challenge you guys to prove me wrong. As EOD guys, man, you guys are kick doors in, you're aggressive, you like no is not an answer, you're pushy. Man, when you guys start to transition, you guys become the most submissive individuals I've met in my life. Don't do that. Continue to push in those doors, ask questions, be involved. Don't become submissive. Like, I don't know why. So just be aware about that about yourself and call yourselves out on it. And because you're going to get a lot of no's. Oh, you can't do that. It's like, oh, really? Like, I don't know about you. I usually take 3 times to get the same no, right? Or different no's from 3 different people about the same thing. And then I go, okay, they're probably right. So just continue to help each other out. There's resources. Miraculously, I've talked to a bunch of guys. Oh yeah, they give me a lot of great information, but they refuse for some reason to add it to the Facebook group to help others out. So don't be that guy. Help each other out, because you're not competing against each other anymore. So you have nothing to lose and literally everything to gain. But nobody can help you if you don't signal that you need help. And that concludes my portion of the. So I guess we could do questions. Right?
I have a question. So as you were starting to go through your own process and put together all of your documentation, how long did it take you before you were able to submit your package? Documentation.
Okay. Make sure so how long did it take me to submit my documentation, say, to the VSO?
Yeah, well, how long did it take you to put it all together as you had to gather?
Okay. So, I mean, I looked at 180 days, and I'll be honest with you, I got my medical record at about 2 months out from that. And that gave me 60 days to look through, because I'm gonna tell you, if you're an old guy like me who has a physical medical record, you're going to spend a lot of time deciphering hieroglyphs of those doctor notes to try to understand like what they were writing. But really, I realized that you just kind of I was going through there going, oh, yeah, I had bronchitis like 7 times. Oh, if somebody were to ask me, have you ever had bronchitis? I would have said no. I've never had bronchitis, but I'd had it multiple times. And then come to find out, it's a very common thing amongst divers who dive mixed gas diving. I didn't know that. So 60 days prior to 180.
Thank you. So we
Now-
have a question that came in through the chat, a follow on regarding the BBQS. They can see, so Mike, you can see that the VA website will update the BBQ list, and they don't have any obvious BBQs such as TBI. Any recommendations on finding BBQs not currently on the va.gov website?
I'll be honest with you, I don't think I ever went to the VA website. I literally just went to Google and typed in DBQ and whatever the condition was. But I kind of, if there were multiple ones, I just made sure that I looked at the revision date on the document to ensure that I had the latest and greatest.
For TBI and PTSD, you need to put initial because there's 2 exams for them. It's either initial or review. And those who are doing BDD claims will always be DBQ initial TBI or initial PTSD because they have additional questions on there that the increases or review does not.
And that's a good point. Like, I mean, that PTSD one, it's pretty lengthy and it has like a bunch of blocks. And when I was filling out the medical evaluation to give the doc, I literally was going down DBQ and go, oh yeah, I probably should talk about that. Oh yeah, let me talk about that. And I know for me, what was a reoccurring trend was, frequency and duration of any event, and then how it affected me both professionally and socially. That seemed to always be a repetitive thing that the DBQ. So I would just go ahead and put it in there. I hate to say it, man, I can't walk long distances anymore because my feet hurt so bad. And personally, that affects me because, well, I can't be as involved with my son's Boy Scout troop when they do hikes. And, it's a blow to the ego, but, it's what it is.
We have another question coming through the chat. How much, if any, do they review your medical records, or is it up to the service member to compile all the paperwork and forms?
It depends. So it's a case by case basis. BDD claims, as a rater, I view very little of your service treatment records. The main document that I go to is your entrance and exit exam. That is my golden ticket that I look at because you're active duty. So I really don't need to dig through your medical records since you are doing these exams while you're still active duty. The only way we will deny is if you do not have a diagnosis. Now, if you file a claim once you transition and you are no longer active duty, I will read every document. I will read and I will find every date you complained of any symptoms related to the claim disability, and I start scrutinizing the medical evidence a little bit more after you've discharged.
So I'll pipe into this, as far as the medical records and all that. I pretty much had to go through my own medical records. I know here on the West Coast, we used to have a really good recovery care management. They have them both on the East and West Coast, but that contract's changed now. And of course, the guys who used to work there kind of almost did what a nurse case manager would do. They reviewed your medical record, would go, hey, you need to go back and be seen for these things, and help you get your record to where it was 100%. Now, if you're like every other EOD or diver, you never went to medical. You didn't get anything documented because you didn't want to get taken off a deployment. That's, I would say, when they tell you to start 2 years out, this is the 2-year part that they're doing, is you're going through and you're starting to document like all those joints that hurt. You're starting to go to physical therapy. Probably go to physical therapy. You probably should have been going 2 years ago. But yeah, you're going to use that 2 years to help get your medical record up to where it is. I think the guys who are on the ships, they go to medical because it's just right downstairs, and they're able to get out because they have all this documentation. They're good. But for EOD guys, it's you kind of have to go back and get stuff documented, all your problems. So yeah, it's up to you.
So Lauren, I have a for you. Have you ever reviewed any packages where you have found that some of the submissions are not entirely truthful, or there isn't enough information for you to be the confirm it?
Well,
Yeah, I have, yeah. But it's, as a VA rater, I am an expert reader. I know the federal regulations. I am not a medical provider. Although some of us may have degrees in that field, my colleagues, we're not allowed to make that determination. So even though I may find some contradictory information in your service treatment records when it comes to a BDD claim, if you have a diagnosis, the laws are pretty clear cut. We grant, unless you had it as a pre-existing condition prior to military service, there's no reason for me to ask or dig any further, even if I find something that doesn't seem right. That's why I wouldn't stress if you were never seen for a knee or never seen ankle. Just because there isn't anything doesn't mean you can't get service connected. You inform that on your claim that something's wrong. And that's why you go to these examiners, and the examiners tell us if you have a diagnosis and then what the impairment is. And I use all those questions that you'll see on the DDQ, apply them to the current policy and regulations to determine your percentage. But as long as you have a diagnosis, you're golden.
How is fraud usually handled? How is
What was that?
How is fraud usually handled?
fraud.
Fraud. This fraud is not, I have never seen fraud on a BDD claim, but we do have veterans who file increases, new claims once they've discharged from the military. I understand the VA is a headache, that we can be not clear about what is needed or anything when it comes to trying to get things increased or service connected. And sometimes veterans go to examiners. We call them pay for play. And what that means is they paid for a medical appointment out of their own pocket and have an examiner who is not their primary care manager or doctor evaluate their conditions on a DBQ, sign it, submit it, and hand it in to us as an increase. Unless it's supported by medical records, it's considered fraud. So we do get those. You will have, every rater's different. Sometimes you have, a rater who will grant if they see medical evidence that resembles closely to what the pay for play provider is saying. But a lot of times we go to your VHA records, we have access to it. We have access to your service treatment records, your personnel records. And if we don't see anything that makes that evidence true, we will either confirm, continue, or deny the condition. And depending on what the doctor is, a lot of these have 1-800 numbers on their DBQs, which is an obvious pay for play. A common one is one in Florida, Gina Ubright. There's one in Puerto Rico, and we turn them over to OIG. So we compile a list and we all know, and as soon as we see that, Gina Ubride is known for her 10-page medical opinion regarding sleep apnea related to service. But it's not supported by convincing scientific rationale. So we'll ask another medical examiner.
Thank you. So I'd like to be able to open it up to the group now. We've got about 15 minutes left, and I know there's been a lot of information covered, so I want to make sure the group has time to ask any additional questions.
I don't know if Jack Davis, if you're on, but he did have not so awesome exam for his audio. So I didn't know if he's on to talk about that.
He was, but I don't see him on any longer.
He didn't have an awesome exam for audio for you EOD guys, which is okay because it doesn't matter what the examiner states. It's like I said before, it's during active duty. So as long as you have a diagnosis and the examiner, even if they gave you a negative opinion, I'm going to ignore it as a rater. You're on active duty. You meet all the elements. I don't care what they say. But we did have an EOD guy who went to an audiologist. And like I tell most people, you know, explain your job. They need to understand that. And he tried to explain, and the provider kept thinking he was in the ammunition supply thing and telling him that just because he's around bombs doesn't mean he was exposed to loud noises. So she gave him a negative opinion, but it doesn't matter. But still, you know, you will have some bad examiners out there. So just try to keep your cool in the exam. You know, try not to get too angry with them, but as long as you have a diagnosis, you're golden. And I am very active on Todd's website. So if you ever have problems, I'm there. I can help out any way I can for advice and how to argue anything if need be, or if you need help filing your claim and making sure you claimed everything, I'm there to assist anybody I can. I won't write your claim. It's a conflict of interest, but I'm there to help you guys.
So if you wanted to take yourselves off mute, then you can have the ability to ask any questions that you might have.
Hi, this is Deacon Donnelly. I wanted to kind of pose a question or just get confirmation. I was watching a YouTube video and they were talking about when you go in for joint range of motion and things like that, to make sure that you know, like Todd said, you don't try to cover it up. You try to think to your worst day that you can recall. And even when you go to the front desk or reception, that if they ask you how you're doing, they said this ended up in an exam, actually in the findings, is the person reported to the receptionist and they asked how they were doing and said, oh, I'm fine. And that ended up in the final report. It's basically, you know, it seems like we're gaming the system, but you know, if you go in on a good back day and they tell you to touch your toes and you do it with no issue, that's what's going to end up in the report. I was told to game the system when you go in for your comp and pen exams.
I wouldn't call it gaming the system. You know, you're kind of just you have to be able to display what your worst day is. I do advise you, you know, if you feel pain on your back when you bend forward, the moment you feel pain, you should stop. If you're continuing to move any joint when it's painful, that's what I call you're sucking it up. And this is not the place to suck it up. You know, it's going to be hard, especially on the joint exams, because you're going to feel like a big baby. But it's just about taking care of you after. And I have seen where a doctor does call a person out. Joint exams can take anywhere between 1 to 3 hours on these BDD claims, gen meds. And the doctor on some of the joints said, this guy sat in the same chair for 3 hours and did not move. I do not believe him. All range of motion is full because he was able to sit there without any complaints. So I have seen that.
Okay, thank you. The other one I would just ask your opinion on is mental health conditions. I know that a lot of combat vets, we do have specific incidents we can recall, but in this community and in special operations or support, we normally have adverse childhood experiences that kind of compound into poly or complex PTSD. I didn't know if that was looked on as like derog, or if that your in-service experiences help to build that and basically exacerbate that claim. If there's any reason to dismiss PTSD due to ACEs or pre-existing issues. And I think that would go for a lot of people on the line, because we're always worried about that and claiming stuff and trying to hold stuff close to the chest. But, if you're in your window, you probably need to come out with other.
That's a great question. Pretty much how we look at that is you need to go back. If you have access to your entrance exam, I would go look at that. And if you noted anywhere on there that you had a previous history of depression or PTSD or problems as a child, alcohol or whatever, then I would recommend you filing your claim a little bit different. And I would advise you, for whatever claim is on that entrance exam, to state the military has aggravated the pre-existing condition. That's how I would go about it. If your entrance exam is silent and it shows nothing when it comes to any type of mental or anything, legally, that's the presumption of soundness. So it does not matter if you attend any of these exams, mental, and tell that examiner, I attempted suicide in my teenage years. I was on a depression medication when I was 12. There's no medical evidence to support your statement. And there is a regulation for veterans that states if it goes against the veteran and no medical evidence to support it, I am to ignore it. So if your entrance exam does not show anything, I don't look at it. I don't care what happened prior to service. I care if you currently have a diagnosis.
Okay, that's awesome. I actually I found on BOL there's been Bupers online for people that all my medical entrance, enlistment, everything has been recently uploaded on there. I think they did a major update to the system, so people could look at those entrance exams via Bupers online, because I just found it earlier this week.
Well, good. That's great to hear. I didn't know that. But I would recommend, and if you have something like you broke your arm or had surgery, you just need to claim it differently. It's just, although you had a pre-existing condition, claim it that military aggravated your pre-existing condition. Because that, especially if you served 20 years and you did combat or parachuting, it's very likely that happened. And it progressed that condition past a normal progression, and you'll get it service connected. So we do view your entrance exam, and we will start asking medical opinions to examiners and get their medical expertise on if they feel it has progressed. I would also advise you, if you have had a very, very busy career and you have not been treated for something that was pre-existing, like a broken bone or something, go get treatment. Go get seen a couple times before you get out. Note it on your separation exam. Provide medical evidence. You need to provide the objective evidence just to help support your claim, because if it was denied, you have a basis to argue. You don't need to do that for everything, just for those issues that have been pre-existing. But keep in mind, if you talk to veterans who got out last year, their rating schedule has been changed and went under a mass rehaul effective February 7th of this year. So there are certain disabilities that are not rated the same. So if your friend last year got 50% for plantar fasciitis, you're going to get 10% this year. Okay. So case by case basis, different laws, different time frames. Keep that in mind as well.
Awesome. Thank you.
We've got about 5 minutes left. I want to make sure that everybody has their questions answered before we conclude today.
If nobody's got a question, there's one thing I kind of want to bring up that about someone asked about timeframes and stuff like that. On the NSOF Facebook group, there at the very top is a living document that is a transition checklist that looks a lot like an ERP, emergency response plan. In fact, it's called a transition response plan, and it will prompt you at certain months and time frames to execute certain things, like go get your medical records, submit for your VSO, look at your medical and dental for you and your family once you get out, those kind of things. So that's there. It's a living document. And what do I mean by living document? As you guys go through this, as you see things that have changed, you just update it. So that, because if you go Google like retirement or transition checklist, you'll find a bazillion of them that were done 10, 20 years ago. And the VA stuff and transition and even the Navy changes so fast that all those other transition sheets are kind of irrelevant.
And also, speaking of the timelines, just so you guys are aware, BDD claims, the point of them is to have a rating before you discharge. I get it. COVID really threw a wrench in our process. It has backed up a lot of people. And although you got your exams really quick and you got them within 1 month, we don't always get them that quickly. Sometimes it takes 6 months. There is a national backlog of getting these exams from the contractor. We're just waiting on them. Once we get all the evidence, the DD 214 a lot of times, and these exams will make the determination happens very quickly, usually within 48 to 72 hours, and you'll get notified on your va.gov site first before you get anything in the mail. And usually you get, if it's been a few months after discharge, you'll get your deposit before you get your notification letter. But just keep in mind, try to be patient, and I would advise you to not rely on this set of money at all. You need to be prepared for that. So for those of you who are not retiring and do not have a pension, it can take, and I have known some individuals to get their rating 6 months after discharge. And although we're working, we're on mandatory overtime getting these ratings out, it's still a national average of 6 months. So just be advised, even though your exams happened or a while ago, it's taken us a while to get all the evidence.
So Todd, if they're not on Facebook, is the transition response plan a document you can send out with the slides, or is it really just a fluid document that is being updated constantly?
I can send a link out that would give them access to it if they're not on Facebook. But for those who, like, I've had a couple of people like, oh man, I don't do Facebook. I like, well, like, look, man, there's a resource for you. If this is a thing that keeps you from using it, you're a grown man, you can make those decisions. But the resource is there. I just tell people like, okay, hey man, make you a Facebook account. Don't add any friends, change your name, whatever, to, Bo Diddley, and have access. But yeah, we can also send it. But the problem is that would be the only thing you'd have access to. You wouldn't have access to the threads about combat related special compensation, or how do you file for heroism pay if you've got a combat fee or higher, those kind of things.
Great, thank you. We just about hit our time, so I want to thank everybody for making the time to attend And I especially want to thank both Lauren and Todd for sharing all of this information. This has been incredibly invaluable. So thank you both so very much. Just in closing, so we will be sending the link to this recording out. We'll also be sending the slides, and then we'll also be sending you a survey just to get your feedback. So with that, I will wish you all a very good afternoon and a very good evening, and thanks again. Okay.
Bye-bye.
Thank you.